Antimicrobial resistance has affected us in many different ways. Firstly, it has increased the cost of treatments for those with drug-resistant infections. And in many instances, it has also increased the risk of dying or having poor outcomes from infections. Consequently, this also affects the socio-economic situation. The other problem that we are now facing is that there is the problem of drug resistance in food, especially in meat products. And this is an issue that we haven't really figured out how to tackle anywhere in the world.
Actually, we need to better understand the whole process of AMR development. And some of that is social, but at the same time, a lot of it is actually basic science. It's trying to understand why certain bacteria become resistant and how that happens. And we have to look at it in a planetary health kind of way. So it's not just the one health where you have humans and animals, but it's actually planetary. As you look at soil, you look at the plants, you look at the whole ecosystem and try and understand how these interact. We do tremendous things to our ecosystem. There's a lot of construction, there's a lot of environmental changes. We have to take a good look, a deep look at how these will impact antimicrobial resistance, because ultimately these are the bacteria that are going to be living in our skin and our intestine. And if we get surgery, they're the ones that are going to be causing problems.
Antimicrobial resistance, or drug resistance, is a difficult scientific problem to solve. Our research takes three angles. Firstly, we are looking at understanding of the basic science of how AMR develops. From this basic understanding, we are trying to develop new interventions to tackle AMR. Thirdly, we are trying to assess the impact of both AMR in our environment, on patients, as well as the interventions that we plan to do. This gives us a kind of a rounded view to tackling AMR problem both locally and in the region.
So during the 2 weeks of attachment with Infectious Disease Department of Tan Tock Seng Hospital, I saw firsthand how multi-drug resistance bacteria is a prevalent issue here in Singapore, and I felt that doing research in antimicrobial resistance is very useful in helping us to understand the mechanisms as well as the evolution of antimicrobial resistance. And I believe that working in this research would have an impact in addressing the issues of antimicrobial resistance. So in our lab, we have been performing environmental sampling to try to understand the prevalence of antimicrobial resistance in the environment, as well as to understand the mechanisms of how bacteria can acquire these antimicrobial resistant genes. In our lab, we also have developed an innovative point-of-care diagnostics, where we hope that we can apply this point-of-care diagnostics in resource-poor settings so that we can treat and detect antimicrobial resistance right at the clinics.
We cannot tackle this global problem in isolation. It's a problem that affects us in the whole region. So we need to understand the factors that bring about AMR. Across Southeast Asia and in East Asia, there's a diversity of healthcare practices, of agricultural practices, tightness in regulation of antibiotics, for instance, of susceptibility of individual populations. And so these all contribute to the emergence of increasingly resistant organisms. We've seen that occurring from countries in Asia. We need to understand how these factors influence the spread of drug-resistant organisms. And so we have been doing some work, not just in Singapore, but also out in the field. As we are a medical school, we involved in training the next generation of clinicians, of researchers. These actually help to open our students to new vistas of tackling the problem, not just face-to-face with their patients or in the laboratory, but appreciate the larger, more holistic aspects of tackling this problem.